Hello, I am Dr. Karthik Rao. I am Additional Director, Urology, Uro-Oncology Robotic Surgery at Fortis Hospitals, Bangalore. Today we have with us Dr. Mohan Keshavamurthy, Senior Director, Urology, Uro-Oncology, Renal Transplant and Robotic Surgery. We are here to discuss about robotic surgery. So what is the future of robotic surgery in India and what other innovations are possible in the field of robotic surgery?
So there are three parts to this story, evolving story of robotic surgery in India. The first is access. So far what has happened is robot comes with a cost. The accessories which we use for the robotic surgery adds a lakh of Indian rupees to any procedure you would want to do. Centers with like the Fortis Hospital at Bannerghatta Road, where we are privileged to work, because of the high volume of surgery, we can subsidize costs to a few patients. We don't refuse anybody who deserves robotic surgery. But there are not many centers in India with the kind of volumes of doing 1,000 robotic surgeries a year. So the first thing that I envision in the next 3 to 4 years are greater access to robotic surgery. There will be more robots in the country, not necessarily Da Vinci or a different version of Da Vinci, and you will see most district centers, secondary metros, being enabled with a robot. It might be the Da Vinci, a different version of the Da Vinci, a cheaper version of the Da Vinci, or indigenous robots like Mantra, or it could be a robot manufactured elsewhere but at a lower cost, both for the cost of the buying the robot and for using the robot. So the first thing is access. I see access to robotic surgery rapidly evolving in our country. We are a big country, and that's the first thing. The second thing, equally interesting, would be how would the robot, in terms of training and skill, change an individual surgeon's practice. So we are going to see a lot more surgeons who are open or lap convert themselves to robotic surgery. So you're going to see standardized training, standardized protocol centers which are willing and capable of training Indian surgeons in the art and science of robotic surgery. So the first is access. Second is people who can run these machines. These machines can be put in secondary towns, but you need skilled surgeons to run it. So I see a greater ability to train Indian surgeons in the art and skill of robotic surgery. The third, of course, is the biggest difficulty in the robotic platform right now, such as Da Vinci, is lack of tactile feel. So you will see robots which come with tactile feel, which will make it then a technique which is immensely superior. Right now, what makes the robot superior is all the points we elucidated before, but what makes it difficult right now to become a robotic surgeon is lack of tactile feel. An open surgeon uses his forefinger like his eye, but without tactile feel, everything is visually dependent in the robot, and that's the part of the learning curve all of us have to learn when you want to become a robotic surgeon. But a robot with tactile feel is like Bahubali. It should be able to do everything effortlessly. So that's the third thing I see. Robots with greater ability to be helpful to the surgeon. And the last, of course, is telemetry. You sitting in your home and guiding a younger surgeon across the globe in any part of the globe. The only thing that is required there is redundant internet. That is, you should have more than one internet, more than one power supply, so that even if one power supply and one internet connection fails, still the transmission of a mentor guiding a mentee anywhere in the world to do robotic surgery, what we call as telemetric robotic surgery. This is an old concept. In fact, 25 years ago when the robotic surgery was evolving, one of the purposes of Pentagon was to utilize this in war zones, where the injured soldier, American soldier, would receive the best of surgical help with a best surgeon sitting in his home or hospital in the United States, far away from the battlefield. That concept of telemetric robotic surgery is going to come in. So I look at access, better training, greater access, better training, better machines, cheaper machines, and telemetric ability to perform robotic surgery. These are the exciting advances which should happen in the next 5 years, and it should make your career far more fulfilling than mine.
Thank you, sir.
Thank you.